causes of renal cell carcinoma is not always known. It is understood to be the result of genetic mutations that cause kidney cells to grow uncontrollably. A wide range of factors from lifestyle choices to hereditary conditions increase the risk of these mutations occurring. The primary cause of clear cell renal cell carcinoma is a mutation in the von Hippel-Lindau gene, the VHL gene, which occurs in the majority of both hereditary and sporadic cases. This genetic alteration leads to uncontrolled cell growth and high vascularity in the kidneys. While the VHL mutation is the foundational cause, other genetic mutations as well as environmental and lifestyle factors contribute to the development of this cancer. Urothelial carcinoma. These causes generally involve chronic irritation, infections, or inflammation of the urethra, leading to the cellular changes that can become cancerous. So human papillomavirus infection, the HPV virus, certain types of HPV, especially type 16, are strongly linked to urethral cancer. Chronic irritation and inflammation, long-term or repeated inflammation of the urethra is associated with an increased risk of urethral cancers. Causes of this chronic irritation include frequent urinary tract infections, sexually transmitted infections, long-term use of urinary catheters can all cause all that irritation and inflammation. Urethral stricture disease involves scarring and narrowing of the urethra. This is a risk factor, particularly in men. The chronic inflammation and repeated treatments can increase the risk of squamous cell carcinoma. Bladder cancer history. Individuals who've had bladder cancer are at higher risks of developing urethral cancer. This is because the same type of cells, the urethral cells, line both the bladder and the urethra. Infections with certain parasites, so while it's extremely rare in the United States, infection with the Schistosoma hematobium parasite can cause inflammation, and it's a known risk factor for urethral and bladder cancers in parts of the world. Wilms tumor is caused by genetic changes in the early kidney cells. So it occurs during fetal development. Certain kidney cells may fail to mature properly and instead remain in their immature embryonic state. If these nephrogenic rests do not mature by the time the child is 3 to 4 years old, they can start to grow uncontrollably and form a tumor. With renal sarcoma, the precise cause is often unknown, but it's linked to genetic mutations, prior exposure to radiation therapy, and certain inherited cancer syndromes. Some of the genetic disorders, such as Li-Fruman syndrome and neofibromatosis type 1, are inherited conditions that significantly increase the risk of developing several types of cancers, including soft tissue sarcomas. Going on to the other risk factors of renal cancers, like other cancers, lifestyle and modifiable factors such as smoking, obesity, high blood pressure, occupational exposure, physical inactivity and diet, and certain pain medications such as acetaminophen and non-aspirin NSAIDs have been linked to an increased risk of kidney cancer. Genetic and hereditary factors. So the risk of kidney cancer is higher in those with the first degree relative, such as a parent or sibling that has had the disease. Inherited syndromes, the rare genetic conditions significantly increase the risk of developing kidney cancers, and they include the VHL disease, Birt-Hogg-Dube syndrome, hereditary papillary renal cell carcinoma, tuberous sclerosis complex, and those with the sickle cell trait. And then going on to the pre-existing medical conditions, also linked to renal cell carcinoma. People with chronic kidney disease, especially those on long-term dialysis, have a higher risk of developing kidney cancer. This is often due to acquired cystic kidney disease. which can develop in dialysis patients. The hepatitis C infection, some studies have found that people with a long-lasting hepatitis C infection have increased risk. Diabetes, there's some evidence suggesting the link between diabetes as an increased risk of kidney cancer. And then those who've had kidney stones, the evidence is not conclusive for all populations, but some studies have suggested the history of kidney stones may increase the risk of kidney cancer, particularly in men. And demographic factors also play a role. So renal cancer is about twice as common in men as it is in women. The risk of kidney cancer increases with age, with most diagnoses occurring in people over 55. And in the United States, American Indians, Alaskan Natives, and African Americans also have higher risks of kidney cancer compared to other ethnic groups.